Hello and welcome back to Science of Medicine. In this video, I want to take some time and work some applications to the clinical applications of the physiology that you've already learned on the heart and the cardiovascular system. As always, if you enjoy these videos, please leave me a comment or like this or subscribe so that you'll know when I place more videos on. So let's get started. Suppose a patient is placed on 3 new medications, digoxin, metoprolol, and diltiazem. All 3 of these work by blocking the conduction system through the AV node, so they're nodal blocker medications. If they're successful, what will be the patient's heart rate, and explain why this is the case? So I hope that you recognize that if you block conduction through the AV node completely, the backup pacemakers near the AV node will take over, and so I will get a junctional rhythm. I'll have a heart rate between 40 and 60 beats per minute. And I will see sometimes patients that have nodal blocking, and this can be done what we call iatrogenically, which means that a person gives them medications. Digoxin, which is an older medicine, less used now, actually is very famous for doing this, especially when it's at higher concentrations in your blood. Let's talk about a patient developing a blood clot in the left femoral vein. That's the left side, big vein that drains the left leg. And it occludes that left vein. The resultant leg below the level of the clot swells. Why is this? All right, so remember that my capillaries will leak some small amount of fluid. The hydrostatic pressure inside the capillary will tend to push out some fluid. That fluid will be devoid of protein in cells if it works well. And then the oncotic pressure, as you move down that capillary, will increase, drawing some of that blood back in. Part of it will also be brought back to the heart via the lymphatic system. So if I occlude the vein that's draining out from that capillary as it goes back to the heart, it creates a back pressure. That back pressure then is increasing that capillary pressure, and therefore you'll have an increased flux of fluid that will be squeezed out into the interstitial space. And that's what causes the edema. And this is a very common symptom of people that have a blood clot in a limb, an arm, a leg. And you'll see this as be one of the things that you'll see most frequently. Good. So the drug Dopamine causes vasoconstriction of arteries, and we use this as a means to raise blood pressure. If the effective radius of blood vessels is decreased by 10%, what blood pressure change is expected? So I hope that you recognize that we would use Poiseuille's law, but this time we're going to go ahead and re-examine this in terms of pressure and radius. And remember, the flow was directly proportional to the 4th power of the radius, but the pressure is inversely related to the 4th power of radius. So we have our viscosity and length of our tubes and flow and all like that, but assuming those are all constant, I can take a ratio where I have 2 pressures. One is the normal pressure, we can call it P1, and it has a certain radius associated with it. And then when I actually will change the radius of the other one, call it R2, there will be a resultant pressure change. And so that ends up being the ratio of radii to their 4th power. And I can solve that, putting in my 10% decrease for my new radius. And I'll get the pressure changes relative to each other. It goes from 1.00 to 1.52, which is a 52% increase. Now, a patient develops hypotension or low blood pressure from an infection in her blood. Which of the following compensatory measures will help her maintain her cardiac output? A decrease in heart rate, an increase in heart rate, a decrease in her blood oncotic pressure, or an increase in blood oncotic pressure? So I hope that you remember that cardiac output is simply heart rate times stroke volume. If I want to increase heart rate, if I want to increase cardiac output, I can increase heart rate or I can increase stroke volume. In this case, increase in heart rate was what was one of the options, and that is the correct answer. Which is why when you get sick, and especially if your blood pressure starts to drop, you will become tachycardic. This is a compensatory mechanism. A 25-year-old marathon runner has a stroke volume of 80 milliliters. If his blood pressure is 100 over 60 millimeters of mercury and his heart rate at rest is 50 beats per minute, what is his calculated cardiac output? So remember that cardiac output, heart rate times stroke volume. I've given you the heart rate and I've given you the stroke volume. I gave you some additional information. You don't need that. And so 50 beats per minute times 80 milliliters gives you 4,000 milliliters per minute, or 4 liters per minute. Good. Let's try another one. One popular automated blood monitoring system involves the use of oscillometry, in which the blood pressure cuff is slowly deflated and tiny pulsations are used to measure the mean arterial pressure. And then an algorithm is used to determine the best corresponding systolic and diastolic pressures. If such an instrument measures a person's mean arterial pressure to be 80 millimeters of mercury and estimates the diastolic blood pressure at 60 millimeters of mercury, what is the calculated systolic blood pressure? So now remember, mean arterial pressure is a weighted average, 2/3 the diastolic plus 1/3 of the systolic. I can take that formula and then rearrange it to solve for systolic blood pressure. And when I do that and plug in the figures, I'll get 120 millimeters of mercury. Now, I hope that you understand that even though the instrument is going to read out the systolic or the diastolic, that you have to compare apples to apples. So if you actually have a measure of mean arterial pressure, you want to compare that with a measure of mean arterial pressure. And so that's why I was giving this kind of problem, to make sure that people could actually do this fairly trivial kind of calculation. Here's another one. A patient has cardiac arrest. That means their heart stops. They have CPR, high quality CPR that is administered, and a ventricular rhythm develops afterwards. This is a very common scenario. Which of the following rhythms is consistent with this injury? And I give you 4 different rhythm strips here. So I want you to look at these carefully. Think about this clinical picture, recognizing that you're looking for a ventricular rhythm, and then say which one is actually the one. I hope you recognize the top one is the only one of those that is a ventricular rhythm. The second one is a junctional rhythm, and these are both sinus. One is normal sinus, the other is a sinus tachycardia. And those sinus rhythms always originate in the atria. They always originate in the SA node, as opposed to the junctional, which is right around the AV node. But this is a ventricular rhythm. You see the widening of the QRS, the discordance of the QRS and the T. And this is something that you will see very often after cardiac arrest. So I hope that this has given you a little bit of practice in using this knowledge. As always, if you have any questions or comments, you're welcome to leave those in the comments section. And I will see you back in Science of Medicine a little bit later on, and we'll continue on some additional topics. Have a good day.